morning with the breaking news that Pfizer is shipping out the first doses of the coronavirus vaccine as we speak.
In the last few minutes, the UK's mass vaccination programme against coronavirus has begun.
This woman, a personal support worker at a Toronto nursing home who has worked countless double shifts, is among the first Canadians to get a COVID-19 vaccine.
These vaccines, as we know it, are safe. They're not live virus. They're bits of protein. And so far, they haven't had any problems with either the Pfizer or the Moderna vaccine.
There's a lot of questions, a lot of misinformation out there about the COVID-19 vaccines coming to market.
So you have two choices at a moment like this in human history. You can look up or you can freak out. You can look up or you can freak out.
From Triple E Media, I'm Ramat Mohammed, and this is The Backstory. When COVID-19 started to spread globally way back in February of 2020, which seems like such a long time ago now, we all had so many questions. What is it? How contagious is it? Is it deadly? What are the symptoms? How do we avoid it? How do we cure it? And as the months went by, we got some answers. COVID-19 is a virus. It could be deadly for some, not deadly for others. Wearing masks and washing hands could help slow the spread of the virus. And then we all decided as a global community to lock down. Country after country closed its borders. All together in near unison, the world slowed down. All routine activity stopped, except for one: science. Scientists around the world have been working non-stop to accelerate the development of a vaccine so that we can get back to doing that thing which makes us human, interacting with other humans. And in December, they delivered not one, not two, but 3 vaccines that appear to be safe and effective at providing some level of immunity against the virus. But their hard work and the sacrifices that we've all made in 2020 will only make sense if we are willing to take the vaccine. I sat down with my colleagues Anthonieta, Kalunta, Alexandra Gekpe, John Iwodi, and Richard Anyebe to discuss some of the misinformation around the vaccine. Anthonieta, let's start with you. What kind of information are Nigerians getting about this vaccine?
Well, first, you'd remember that when the earlier cases of the virus started back in March of 2020, people didn't really believe that the virus is real, and so many conspiracy theories started to go around. By the end of December 2020, Nigeria had over 85,000 confirmed cases and over 1,200 deaths. But some people still don't believe it and continue to spread these conspiracy theories. You can imagine what kinds of conspiracy theories and misinformation will be going around about the vaccines.
I am calling on all Africans, particularly Nigerians, not to accept the use of any vaccine for now.
That's Dino Melaye, former senator, one of the highest offices that you can hold in this country. Senator Melaye points out that we still don't have vaccines for cancer, HIV and AIDS, and diabetes, even though we've been researching them for a very long time.
How is it possible on earth that in 1 year you found a vaccine for COVID-19?
Science, sir. It's called science. The former senator then goes on to say,
An intelligence gathering have revealed that some of those who took that vaccine died within 3 days.
According to intelligence gathering. That's what the senator just said. You see, the senator on his official Twitter bio says he's a private investigator, which apparently now makes him a key advisor to all Nigerian and African leaders about the vaccine.
So I'm calling on African leaders not to allow any vaccine to be or not to allow Africans to be used as guinea pigs by the developed nations for their satanic reasons.
Let me remind you, this is the senator that is speaking. He goes on to say that the vaccine is a killer and that we will not accept it.
Anthonieta, if somebody at this level of education believes this, I can really only imagine what the general population are saying.
Exactly. I heard people say that the vaccine will cause sterilization. Well, we also heard this with the polio vaccination, which was believed to be some sort of depopulation plan. Then there is the belief that the vaccine will actually cause COVID-19. And my favorite one is that the vaccine will alter one's DNA to add an animal's DNA.
Oh, that's a funny one. I think I'll want to be part human, part snow leopard. What about you?
I'll go for cheetah, but not in the zoo. Well, John here wants to be a cat.
Yeah, but like an American cat, not Nigerian.
Then there's this other one going around about the vaccine containing a microchip. People have always been scared of being tracked, and this notion of a microchip being used to track has existed for years. Now, really creative people have managed to take all these pieces of misinformation and stitch them into an elaborate conspiracy theory. One of these is that the virus contains a demonic element called luciferase. According to these conspiracy theories, luciferase is like the mark of the beast. This, together with the microchip, helps a particular cult of very powerful people track and control everyone who has been vaccinated. They can start to control your thoughts. Now, the vaccination will sterilize you so that they have less numbers to bother about. And by the way, Bill Gates is the leader of this cult, or at least the face of the cult.
You know what? That sounds really complicated. Does Bill Gates really have this kind of time?
I don't think so, but unfortunately, that's the type of stuff that's going around, and people are believing it. People who tend to be uneducated and do not have access to good information.
But that doesn't really explain Dino Melaye.
Even I can't explain Dino Melaye. But apart from conspiracy theories and misinformation, there's this other subset of information going around. It comes from what appears to be medical professionals. For example, one video showed a nurse who fainted about 17 minutes after taking the vaccine. Then there is this other one of a person who identifies herself as a nurse. She claims that 3 days after taking the vaccine,
I went to the doctor because I had problems with my face. The whole left side of my face, actually. I have Bell palsy now. And as you can see, I can't smile. I'm trying to smile. I'm just getting embarrassed.
In the video, it appears that the left side of her face is paralyzed. And all of this information has basically been feeding into people's fears about the vaccine. For the people who were skeptical about the virus in the first place, this misinformation just goes to confirm their mistrusts.
Thank you, Anthonieta. Alex, this level of mistrust that Anthonieta just talked about, that didn't really come out of nowhere. What are some of the factors that contribute to it?
Well, we know that there are certain factors that drive misinformation and conspiracy theories. For example, The Guardian reported that in the US, these tend to be fueled by social media, big donors, suspicion of their experts. Also in the US, there's this notion of individual liberty. Government can't tell me what to do. If I don't have to wear a mask or get a vaccine, I don't have to. And there are laws that protect these individual rights.
And Alex, all of these factors, social media, big donors, suspicion of experts, the notion of individual liberty, how many of these factors apply to us here in Nigeria?
Not all of them apply to us here in Nigeria. We do see the social media influence in the spread of misinformation and conspiracy theories. One possible difference in social media use between the US and Nigeria is that here in Nigeria, there are more politicians and more religious leaders who are very active online. And regardless of their educational background, most Nigerians tend to believe what these men say at face value. And yes, they are mostly men. You know, if you're a politician, let's say a senator, a House of Reps member, a governor, it's implied that you are educated, therefore you know what you are talking about. Just like Anthonieta referred to former Senator Dino Melaye. But apart from social media influence, Nigeria's misinformation is not really driven by the factors of big donors, expert suspicion, or individual liberty. No, those are not our problems. Instead, we have religion as a major factor. There's also a deep mistrust of government. There's our faith in traditional medicine. And there's a general lack of common understanding about how diseases spread and how vaccines actually work. So these are the factors that really drive our misinformation and conspiracy theories about vaccines here in Nigeria. So let's take a look at the religious factor.
Hold the head of God. Our Father, we thank you. We give you all praise. We give you all worship.
Nigeria is deeply religious. Roughly a 50-50 split of Christians and Muslims. Most of our community leaders derive their power through religion, and these men are highly influential. Therefore, whatever they say goes. The second factor is the deep mistrust we have in our government. Remember that in the late 80s into the early 90s, former military president Ibrahim Badamasi Babangida at IBB set a national policy that required all Nigerian women should have an average of 4 children or less, and pregnancies should be restricted to the ages of 18 years to 35 years at childbirth spacing intervals of 2 years.
That's right, Alex. The average Nigerian family is quite big. And especially in the north, where families tend to have somewhere between 6 to 8 children per household.
Yes, exactly. And ever since IBB's proposed policy on limiting the amount of children a woman can give birth to, there's been a deep mistrust of the government in Nigeria when it comes to anything related to health, especially if it's free. In fact, the polio vaccination campaign in '96 was delayed because of this issue around population control conspiracy theories. Several northern leaders felt that the polio vaccines were contaminated with anti-fertility drugs, so they appealed to their people to refuse the vaccines. Eventually, the vaccine campaign was successful and Nigeria was declared free of the wild polio virus in August 2020.
So Alex, is it just government corruption that's fueling this mistrust, or have there been other incidents in the past?
Well, there's also alleged misconduct by private organizations. In '96, the American pharmaceutical company Pfizer ran a clinical trial in Kano State using the drug Trovan. This was an antibiotic for treating meningitis. It was alleged that Pfizer did not meet the global standards for conducting these clinical trials. 11 children died, and several more were left severely disabled. It took 13 years for Pfizer to settle out of court with the Kano government and the families affected. So this incident is still very fresh in people's minds, and it just only leads to further mistrust and misinformation about vaccines and Western medicine in general.
And if we don't trust Western medicine, that's when we fall back to traditional medicines, right?
That's right, exactly. According to an article by Ayodele Samuel Jegede, in 2003, 64% of Nigerians in the South use orthodox health services, going to the hospital, seeing a medical doctor, getting a prescription. This is actually high compared to only 8% in northern Nigeria, where more citizens rely on traditional medicine. And that's probably because of things like the Pfizer clinical trial and IBB's policy on limiting children. Then there are some Nigerians that believe that any disease we catch can be cured by ourselves using natural herbs and products, and this is the same across Africa.
That's right. When this whole COVID-19 pandemic started, I remember Madagascar had started to market COVID organics.
Yes, that herbal tonic cure for COVID-19. Nigeria's Ministry of Health assessed that tonic and found it doesn't work. But this belief that we have about African natural herbal medicines is one major factor that very much drives our resistance to Western medicines, including vaccines. Now, the fourth and final factor is our lack of general understanding about how diseases spread and how vaccines actually work. Most of the general public are still under the assumption that COVID-19 is only killing the rich and our politicians. Most people just don't understand that the vaccine is not a treatment. The vaccine is a preventative measure.
Thank you, Alex. So, John, explain to us, how do vaccines work?
Before I talk about vaccine, let's first discuss what virus is. And I'm going to have Anthonieta help me explain this. A virus is a small infectious agent that can create copies of itself inside a human body. So it basically enters the body the way a robber enters a house. So in this analogy, the robber is the virus. Anthonieta, imagine your body is a house. You are inside that house right now and you are the only one with the key to the house.
Okay, I'm in my house, I'm watching TV and eating cheese balls. A perfect Saturday.
Don't get too comfortable, Anthonieta, because a robber is on his way and he happens to have a key that kind of looks like yours. He puts the key in a certain way and is able to open the door.
Wait, John, did you hear that? The robbers are in my house.
So that's how a virus works. Viruses have these proteins that your body thinks are normal, and that's how they just sneak their way into your body. Back to the analogy. Imagine that once one robber enters your house, he starts to create copies of himself. One robber becomes 2, 2 become 4, 4 becomes 16, and so on.
John, it's getting really crowded in this house. There's so many robbers and they keep multiplying.
And that's what is happening in the body. Once the virus is inside, it starts to create copies of itself. In our analogy, Anthonieta's house is filled with these robbers. So they start to break through the windows and spread outside. They continue to multiply out in the garden and all over the compound.
Oh, my garden.
In the body, when the virus has copied itself a lot in one place, it breaks out of that place and spreads to other areas of the body and continues to infect and multiply. Now, the body has a way to defend itself. It activates the immune system to attack the virus. Back to our analogy. Anthonieta has a security system. She has dogs. The dogs are like the immune system. So think of it like she's sending out dogs to go after the robbers. But Anthonieta only has one dog because she wasn't prepared for this situation. So her house is completely invaded and the robbers take everything.
Oh no, my hair, my bone straight hair.
In the case of your body, when the viruses are too much, you will get sick, and depending on how bad the virus is, you may die. Sometimes the virus may not copy itself quickly, and your body has time to activate the immune system to fight back. Other times, the virus is copying and spreading itself quickly.
John, that sounds really scary. How do vaccines help?
Well, according to the World Health Organization, vaccination is a simple, safe, and effective way of protecting people against harmful diseases before they come into contact with them. A vaccine trains the body's immune system to fight a disease more quickly. In our analogy, it's like Anthonieta is preparing the dogs to recognize the robbers, so that when the robbers come, the dogs can go after them before they even enter the house. Now, the traditional way of training our body through vaccines was to introduce the virus itself into our own bodies, but with kind of like a weaker form of the virus. In the analogy, Anthonieta will bring the robbers into her house to train the dogs so that they can recognize the robbers. But the robbers are in handcuffs this time, so they really can't do too much harm.
Oh, so is this where we get the misinformation about vaccines making you sick?
That's right. And a vaccine will activate your immune system to respond as if you were sick, and that's the point. You're training your immune system to recognize the virus.
Now, John, the traditional way to make a vaccine, that can take 5 years, maybe even 10 years.
That's true. And that's because it follows specific steps. Now, there's the research phase. This is the part where the scientists try to figure out which vaccines will be effective against the virus. So let's say it's like Anthonieta trying to figure out which of her dogs may be strong enough to face the robbers. At this phase of research, you identify many different vaccines. The next step is to actually test each vaccine on the virus. So you give each vaccine to different groups of people who have not been infected, and you wait for years to see if they ever become infected.
So now in this analogy with Anthonieta, let's say she's identified 10 dogs that she thinks might be able to detect robbers, but she still needs to test them to know which one is really strong enough. So she would then take each dog and put it in a different house and then wait for the robbers to come.
Exactly. And since robberies do not happen that often, it may take years for her to know which dog is strong enough. And that's why traditional vaccines have taken a long time to make.
But John, it took 1 year to develop the COVID-19 vaccine, and that has made a lot of people very skeptical. Why were we able to develop that vaccine so quickly?
You see, in the past, you would have to wait years for robbers to come and test how strong your dogs are. But what if you had robberies happen at every minute? So you can easily figure out which dog is the best much quicker. And that's what happened with COVID-19. We had millions of cases all at once, and we could test the vaccines very quickly. The second factor for why we got the vaccines quickly is that this is not our first experience with viruses similar to COVID-19. There was SARS of 2002, there was also MERS of 2012. So scientists have been studying these viruses for a long time, and they were prepared this time.
So John, it doesn't really seem like there was some major conspiracy.
No, just some really good science and a lot of cases to test very quickly.
Okay, but what about this issue of the vaccine changing your DNA?
I think that piece of misinformation started because the vaccine is an mRNA vaccine. And this is a new type of vaccine which the public doesn't really understand. Remember, I said that the traditional way to vaccinate is to introduce a weaker version of the virus into the body. This is like Anthonieta bringing the robber to her house in handcuffs to train the dogs. But instead of bringing the robber to her house, she now dresses up as the robber and uses herself to train her dogs. That's kind of how the COVID-19 mRNA vaccine works. When you take the vaccine, you are getting the instructions that allows your body to pretend to be the virus so that your immune system can train to recognize and attack the virus.
So John, they're not actually introducing the virus into you.
No, but they're introducing the instructions to make a copycat of the virus that your body then takes.
Okay, but will this impact our DNA?
It shouldn't. The way mRNA works, it never actually enters the place where our DNA is stored. Back to our analogy. In Anthonieta's house, the DNA is stored in the bedroom. When the mRNA enters, it does everything it needs to do in the living room or in the kitchen, but it never enters the bedroom. And after the mRNA is done, it destroys itself.
It has a self-destruct.
Yes, it does.
So there's no hope of me turning into a snow leopard?
No, not in this lifetime.
What about microchips? Is Bill Gates trying to track me?
According to an article published in December 2020 by the MIT Technology Review, there are no trackers in any of the vaccines. So as far as we know, Bill Gates is not trying to track you.
And if Bill Gates wants to track me, no problem.
This luciferase that everyone is talking about is a dye that is used in experiments to help detect if the body is actually responding properly to the vaccine. There is no information to indicate that luciferase is an ingredient in the vaccine that have been delivered to the general public.
Okay, what about side effects, John?
So there are definitely going to be side effects, just like with any vaccine you take. Just remember, your body is responding just as if you are sick. According to the Center of Disease Control in the US, side effects can include pain and swelling in the arm where you get the shot. Other side effects are fever, chills, tiredness, and headache. Now, those are the short-term side effects. We don't really know what the long-term side effects are, and we also don't know if there are specific side effects that will affect our population here in Nigeria. Most of the vaccine testing that has been done is mostly abroad. We would have to do our own here.
Thank you, John. Richard, how is Nigeria planning to test and deliver this vaccine?
Well, first, we have to get the vaccine, and we don't manufacture it here. So we will have to buy it, and then transport it, and then store it. John just told you that this vaccine is an mRNA vaccine. This type of vaccine needs special cold storage. The Pfizer vaccine needs minus 80 degrees Celsius for storage. Another type requires minus 20 degree storage, which is the temperature of the regular freezer. And then there is the type we can store at a temperature of 2 degrees, which is also the temperature of a normal refrigerator. Now, according to the Minister of Health,
the one that's a regular refrigerator is easy in that you can just put in where many of such regular refrigerators all over our country. Minus 20 will also be possible because we have freezers, what we call freezers. But the ultra cold freezers, we hardly have any in our country.
The cost of delivery and storage are two key factors to the types of vaccines we will import. According to the minister, other factors include effectiveness and safety.
Richard, let's assume we managed to source the vaccines. What next? How do we plan to test them?
So, according to a report published in December by Bloomberg, Nigeria has a plan to license vaccines that have already been approved by the US and the UK. Normally, the process to license takes months, but this time, NAFDAC, that is the National Agency for Food and Drug Administration and Control, will use a fast-track process to review and license it in 15 days. It's not clear if the fast-track process will involve testing also. And according to Professor Innocent Uja, president of the Nigerian Medical Association, we need to do our own clinical trials.
Because of the biology, because of the environment, because of our genetic composition, we need to do our own clinical trial very quickly before it can be used, on Nigerians. While we do not question the efficacy and safety, these things vary from place to place. The responses vary from place to place.
NAFDAC is the major health agency with the mandate to ensure safety of drugs and other food items in the country before consumption. As of the time we were preparing this report, there was no clear communication from NAFDAC about any plan for testing. The one piece of communication we found about the vaccine was published by The Guardian on December 24th. And that was about plans to trace and track the vaccines once they arrive in the country. So no mention of testing at all.
So there might be a plan for testing, but we just don't know about it.
Exactly. And we don't know who is even testing it. Is it NAFDAC or is it NCDC?
Richard, let's assume we get the vaccine, we store it, we test it. How many people can we hope to vaccinate?
According to the Minister of Health, the country is expecting to receive the vaccine by January 2021. But again, the vaccine will not be able to cover for everyone right away. Chikwe Ihekwazu, the head of the NCDC, told Arise News that the first round of vaccines will cover 20% of the population. That's about 40 million people.
We've been guaranteed vaccines to cover 20% of the Nigerian population. That's about 40 million people. And that's a lot of vaccines to start with. It won't cover the entire country.
But then, Dr. Sani Aliu, the national coordinator of the Presidential Task Force on COVID-19, while speaking to Channels Television, said that the country has plans to continue to procure the vaccines over the next 2 years.
We are also planning to pay for an additional 20 to 40%. In general, over the next 2 years, we need at least 70% of the population vaccinated before we can actually be sure that we have enough herd immunity.
So when the vaccine arrives, will it be free?
The government obviously has to purchase the vaccines from the manufacturers. But according to Dr. Aliu, the government will actually get the first 40 million doses for free, because we have a partnership with the Global Alliance for Vaccines and Immunization, that is GAVI, which will fund the cost of the first 40 million doses. Government still has to bear the cost of administration and other logistics. So the vaccine should be free to citizens, but that remains to be seen.
Hi, everyone. There have been a few updates since we recorded this episode. And the first update is about the story of the nurse who said that the left side of her face was paralyzed with Bell's palsy after getting the vaccine. Well, the Associated Press and other major news organizations have labeled that story as false. There is no record of a registered nurse under that name in Tennessee. Our second update is about NAFDAC's plan to test the vaccine. Now, on Sunday, the 3rd of January, the front page headline of Punch newspaper read, NAFDAC rules out clinical trials. Experts disagree. The Punch headline is based on a discussion that one of their correspondents had with NAFDAC's media consultant. NAFDAC has not yet released an official statement as of Sunday evening. But according to the Punch article, NAFDAC will not conduct clinical trials. Instead, they will conduct what they're calling revalidation testing. It's not really clear from the article what revalidation testing means. And our third update is about the comment made by Professor Uja, the national president of the Nigerian Medical Association. If you remember, he said that NAFDAC should conduct clinical trials. In the article published by Punch on Sunday, Professor Uja is reported as saying that full-blown clinical trials are not really needed, but that we should still do some sort of revalidation. And that's it for the updates. Now on to my closing comment. One of the clips that we played in the beginning of this episode was of Pastor Greg Laurie. He said that in this moment in human history, we can either look up or we can freak out. In Africa, we don't really freak out. We look up to pray. But I'm going to ask you to consider a third option. We can look up, freak out, or we can ask questions. And I have a lot of questions. The GAVI Alliance will cover the cost of vaccine for 40 million of us here in Nigeria. But which vaccines is Nigeria eligible for under the GAVI Alliance? Also, we tend to have certain medical conditions here in Nigeria that other countries do not have, like malaria and sickle cell. Have the vaccines been shown to be safe and effective in a population that also has our type of medical conditions? What is the difference between clinical trials and revalidation testing? What are the requirements for getting the vaccine through the GAVI Alliance? Is one of the requirements that we're not allowed to do our own clinical trials? How many people do we actually have to vaccinate? The US is saying that they have to vaccinate 75% of their population. Where did that number come from? And does that apply to us here in Nigeria, given that our case numbers are much smaller? We have 85,000 cases in a country of about 200 million. The US has about 21 million cases for a population of 328 million. Even if you adjust for the population size, Nigeria's cases are about 150 times fewer than the US. So do we really need to vaccinate 75% of our population? How are we going to prioritize who gets vaccinated? It seems like people who are likely to get the virus should be vaccinated first, like medical professionals, or people who travel abroad, or interact with the international community, like the entire National Assembly and their families, all the residents in the villa, governors, the state assembly, the diaspora, all of the civil service, and the military. Will the vaccine, including the cost of administering it, be free to citizens? How many doses do we have to take to get immunity? If more than one dose is required, will all the doses be free? How long will immunity last? I know that the science has been moving quickly during this pandemic, and we've now reached a critical point. But if NAFDAC and NCDC want our cooperation in the vaccination campaign, they need to start communicating the facts to us in clear and simple terms. We want assurances from you, not from the World Health Organization, not from Pfizer, not from Moderna. We want you, NAFDAC and NCDC, the people who are charged with protecting our health, to tell us whether this vaccine is okay for us to take. This is your job. Own it. The Backstory is brought to you by EE Media Productions. Production copyright 2021 by EE Media Productions. If you enjoyed this episode of The Backstory and want to hear more, give us feedback. Subscribe to our 234 Audio YouTube channel. Visit our website at 234audio.com and download our 234 Audio app. Episodes of this podcast can also be found on Apple Podcasts, Google Podcasts, Anchor, Spotify, Radio Public, Breaker, and Pocket Casts. This episode was made by Anthonieta Kalunta, Alexandra Gekpe, John Iwodi, Richard Anyebe, Dominic Tabakaji, and Sam Tabakaji. Special thanks to Stanley Bentu, Rabia Hadeja, and Mala Iwa Bado Ikaleku. I'm Ramat Mohammed.